Bismillahirrahmanirrahim. Assalamu alaikum. I'm Professor Dr. Gilani, and today we are going to discuss about ultrasound of ovaries. As we know, there are two ovaries in a normal woman. The ovaries are hypoechogenic wide structures with homogeneous echotexture. More echogenic central medulla is seen. In the productive age, there are follicles which help us to identify the ovaries. In menstrual age, difficult to identify due to small size and absence of the follicles. The ovarian blood supply is very important. This is the ovarian hilus, and then is the arcuate of the ovarian branches. Then comes the ovarian stroma, and here you can see the ovarian cortex in which we have the blood vessels. So the ovarian hilus, arcuate, stroma having different branches of the ovarian arteries. Ultrasound in the assessment of ovarian cycle. It's very important to assess the ovarian cycle. The follicle size and growth is assessed. Then the perifollicular blood flow, endometrial thickness and echogenicity. And then we look at the subendometrial blood flow. The follicular growth and size at 8th to 10th day of the menstrual cycle, the mean diameter is 10 millimeters. The maximum diameter can reach from 19 to 23 mm. The growth rate is about 2 to 3 millimeters per day. Here is a follicle. In this case, it is 14 into 13 millimeters. And spectral Doppler biphasic forward flow, and we can see the resistive index is 0.65. In this case, it is 17 into 16 millimeters. This is the feeding vessel, and you can see the biphasic forward flow. The resistive index is 0.54. The perifollicular blood flow is important. We assess its resistive index. If it is 0.50 to 0.55, the hemodynamic parameter of follicular growth. If it is 0.42 to 0.48, it is significant reduction of the vascular resistance in the pre-ovulation phase. The pre-ovulatory follicle, we assess the size, we look for the feeding vessel, and then we measure the resistive index. This is 3D of an ovary with multiple follicles. This is the cumulus ovorus. Pre-ovulatory blood flow again with 3D and power Doppler. Here is the flow pattern of the vessel. Then comes the polycystic ovaries. No mid-cycle peak of estrogen and a low steady state of estrogen causes a complex imbalance of the ovarian cycle. Can cause chronic anovulation and associated with endometrial carcinoma due to chronic unopposed estrogen stimulation, and it can be diagnosed by blood flow patterns. Polycystic ovaries on ultrasound, they will appear like this, having multiple cysts, normal or bilaterally enlarged echogenic ovaries. Volume will be about 10 or more centimeters cubic. Multiple small 2 to 6 mm varying size cysts located in the periphery of the ovary, resembling a string of pearls. We can have hyperechoic ovaries in some cases. This is a polycystic ovary. having multiple small immature follicles at the peripheral zone. This is the central stroma of the ovary. So here we compare the general cystic pattern and peripheral cystic pattern. Here these are the cysts are on the peripheral zone. Here they are mixed. The polycystic ovarian syndrome is characterized with some important things. In addition to the multiple cysts in the peripheral zone, we will have high vascularization of the stroma, in which the resistive index will be decreased. There will be high risk of hyperstimulation. So here are the polycystic ovaries with the polycystic syndrome, and we can see the flow. The resistive index in this case is about 0.509. A polycystic ovary with 3D power Doppler, you can see the multiple cysts here, and stroma is having lot of blood flow on power Doppler. Hyperstimulation, multiple large follicles will be seen when the ovary is hyperstimulated. This is a case with 3D. The ovarian cysts or a follicular cyst, a functional physiological cyst, formed when a mature follicle fails to ovulate or involute, resolve spontaneously. So either it fails to ovulate or it is not able to ovulate and resolves spontaneously. It is functional physiological cyst, which is actually a follicle. So in other words, I can say that follicle which remains there and is not ovulated and is not ruptured, and it is usually of 2.5 centimeters or above in its mean diameter, we label it as a follicular ovarian cyst. Simple cysts, they are anechoic, thin-walled, rounded or oval with sharp margin, and we will have through transmission. Usually 1.5 to 2.5 centimeters at time of ovulation, may increase up to 6 centimeters. This is 3 centimeters, which is 30 millimeters, a follicular cyst, which is a functional cyst. Few more cases of follicular cyst, high resistance to blood flow, and we can see the resistive index is 0.50 in this case. We can also have ovarian cysts which are of hemorrhagic type. We will find a cyst with blood inside, so bleeding into a cyst. On ultrasound, there will be variable characteristics because of clot formation, lysis and retraction. Can appear solid or show a fluid level or focal wall thickening. Can mimic malignancy or a mass. This is a hemorrhagic cyst, ovarian cyst, having a clot inside with the cystic areas. Then comes the corpus luteum. From corpus luteum, we can have a cystic appearance. Here you can see the corpus luteum and a cyst is formed. This was all about the common ovarian masses and different appearances of ovaries on ultrasound. Thank you very much.